Hello and welcome to Reach Live. Thank you for being with us. If you're watching on demand, welcome. I'm Reena Sooch. I'm the host of Reach Live. I'm the head of digital and connected health at Ipsos. Ipsos are a global market research and insight agency, and we do all things to do with data and insight. And Reach is a non-profit organization that is working as a thought leader within digital health. And I encourage you all to click the link and go to reachtl.org and check out all the content that's available to you, including Reach Radio, which you can make to become your favorite podcast if you're into podcasts. And Reach Live each Friday, last Friday of every month, has a guest, and it's an absolute pleasure for me. I get to meet extraordinary individuals and have great conversations. And today is no less. The topic for today is health equity. So, the role of technology in establishing and maintaining health equity. And it's not something we are taking in vain. It's a huge topic, and it requires deep infrastructural change, but also mindset and culture change. And I'm delighted to have our guest here today, who comes from a really interesting background, something quite I find quite engaging and intriguing because it's a state role that she's had for many years, and how it's evolved into being about health equity is really, really interesting. So Mignon, welcome to Reach Live. Please come in and give an introduction to yourself and let everyone know your background and a bit more about you.
It's my pleasure to join you. So you find before you a former regulator, both at the state level as well as the federal level. So I spent about 11 years at the South Carolina State Public Service Commission and about 8.5 years at the Federal Communications Commission. And what I found was, and what was reinforced at those two agencies, is how codependent we are when it comes to regulation, technology, and health equity. The promise of it or it not being available at all. And so, where we find ourselves now is at a critical crossroads, where we need to keep in mind and really reaffirm to ourselves that we are all in this together, that we can do well and do good and be good stewards at the same time. There are very few things that are mutually exclusive, and I think there's an exciting but challenging series of days ahead of us.
Oh, yeah, no, absolutely. So, talk to me a little bit more about state regulation. It's intriguing to me in terms of what is it? What does it entail when you're at commissioning level? What types of decisions are you making, and why are they important?
Well, one of the things about state regulation, a lot of it was further defined with the 1996 Telecommunications Act. I promise not to get too geeky, but what that did was open up the floodgates in terms of competition, and it redefined what regulation was and where it was. You saw things become more open for new entrants, for innovators, all across the nation and across the world. But what you also saw was states getting out of the telecommunications technology business. They were taking more of a back seat. And so while we were still providing protections for what we call POTS, plain old telephone service, just picking up the phone, you hearing that dial tone and dialing from your wall, that phone on the wall, to a whole new wireless universe that is bringing us that mobility, that demand on the go, and all of these things that are more accessible if you are connected, if you can afford that connection, and if that infrastructure is there where you are. So things shifted a bit on the federal side, shifted a lot from the deregulatory side. And where we find ourselves is the regulator closer to your home has less of an influence over what goes on in your most frequently used day-to-day interaction with the internet, with your communications device, and honestly, on the federal end, more of a backseat But today, uh, you see more and hear more conversations about should we revisit some of this? What role other than uh, ensuring that monies are flowing. You've been hearing a lot of money going to the states. You've been hearing that from Congress through federal agencies like the FCC and the NTIA, the Telecommunications Information Agency, that's a part of the White House's uh, orbit. And so you're seeing some shifts, and you're seeing some recognition that with all of this by way of disruption that we've seen since 1996, there are too many people that are being left behind, and we
Mhm.
have to do something about it. There are too many in too many places around this country, rural places and areas where there are low income or low net worth individual. And to be honest with you, with the pandemic and more, that number is going wider and that footprint is getting larger.
Mm. This is why regulation and policy is so important. And when we talk about health and tech, it comes up time and time again because it is the driving force of making things happen. Um, it's interesting to me, you started off in the tech infrastructure space, right? So you're trying to make sure that everyone can get access and you're making sure there's competition, fair competition in the marketplace. Then over time that changes, right? As more things go direct to consumer, as more individuals can get competitive pricing. Talk to me a little bit about that. How does that play out? Does that mean, because that's risky, right? Because a lot of tech today is direct to consumer. So those individuals that can afford it, that have access, that are able to have the health literacy is huge, to understand what they need, are getting what they need. But the gap is therefore getting bigger, much like you just said around COVID, exacerbating the gap. So, how does that play out at a state level when you was in your role? Would you see things start to move more to the consumer and therefore the state would kind of scale back?
So I will say the promise of it is there, meaning more direct and personalized options, for individuals. So the promise is there. But I am not sure, and I will argue on the grand scale that we need it, that the devices, that the tools, that the options are not there where they're needed the most. And what I mean by that is a lot of times when innovators come in this space, they assume that we're all connected. But I just affirm to you on a rural and an urban basis where there are economic challenges, that is not the case. That we do have a challenge when it comes to affordability, when it comes to infrastructure in the ground. There are critical challenges that remain that I don't know if the innovators that you interact with on a regular basis, that they see that they take that into account, that they take into account the inequities that currently exist, the biases that currently exist. Do they take that into account when they are on the drawing board coming up with that concept? When they are designing, do they have those persons in mind? Do they have the people, again, that might not have the digital skills that are innate or that are second nature for them? A lot of people need technologies and can benefit from being connected the most are not digital natives. So, are we from inception to market really taking into account not only their needs, but what your, as an innovator and designer, where your next $1 million will be made? Your first millions might be made from the digitally connected. You're leaving a lot of opportunities on the ground, and our country is not benefiting robustly from a digitally connected health future if you don't think about the rest of us that are not currently a part of this grand scheme that cannot afford today. Because the government is putting its thumb on the scale. $100 million plus is going to each state over the coming years through the states. Those legislators, those broadband officers are going to have a lot of power and influence. Are you, as an innovator, ready? Had you thought about those who need these services? Have you challenged the government to come up with concepts and models that would incent you economically
Mm,
to not only invent, um, but to make a part of your design these individuals? Because if am using your device and you can't see me, and I've had that to happen in the earlier stages of AI and facial recognition, then there's a problem. I am
mm.
invisible, and you're leaving on the table a lot of money and a lot of opportunities, and you're further disadvantaging me if you don't see me, if I was not a part of your protocols and design, if I'm not part of your studies, if I am invisible, you could be actually harming me more. Because
Mm.
if the marketplace or if my clinician decides to adopt these standards or your concept, and you absolutely did not have me in mind, then what type of care am I going to get going forward? So I'm saying all that to say that from a government point of view, from an entrepreneurial point of view, and from an all of the above point of view, we need to say and to ask ourselves, what role do we play in a digitally connected future? And are we looking at every opportunity, every market, and every characteristic needed so that all of us can be improved by your invention?
I absolutely love that. So well said. Honestly, so well said. From intention all the way through to execution. And, am I invisible? Yeah. It's just such a simple phrase, and so many people feel that way. And there is a lot going on really with intention, I'd say. I'll give you an example in the UK. So the NHS are moving forward, National Health Service here, to offer remote patient monitoring for diabetes. And they've recently, it's just been announced in the news that Big Health's product Sleepio, which is a sleep-based cognitive behavioral therapy app, is now going to be available and pushed through, and it's been recommended by NICE guidelines to be first in line therapy before drugs. Great, really strong, but actually on the ground, the rollout has still got huge issues in terms of how accessible is it really, from individuals having to jump quite a few hoops to get what they need within the rules of what's there. So I think, yeah, announcements and all that are good, but technology companies have to really think about where is their products being available, how easy is the experience for every individual. And you're right, if you're not in the research studies, you're not being seen. If you're not in the sample, you're not being seen. Let's talk about health a bit more focused. So I'm intrigued in how your role kind of went from technology infrastructure into health. So give us a little bit about that, because I think that's really interesting.
Well, I thought it was going to be more organic from a government standpoint when I was at the FCC. But when we created what we call a Connected Health Task Force, there were people still asking, what does the FCC have to do with health? And I was just floored that we were getting that question in the 2000s, in the, in the 2000 teens. But we kept pressing, and what we affirmed and what we saw, that broadband is at the epicenter. That's the seed. It that that it and it's our responsibility to help to sow that. We proved it mightily when it came to the schools and libraries program. We call it E-rate. It's a tremendous success in areas of the country where the local communities did not have that 60% delta to afford those computers and connectivities in the libraries in those schools. Why why should health be any different? If you look at those rural healthcare centers and provide opportunities there, provide economic incentives there, then would happen? Then you will have electronic, solutions when it comes to our healthcare records. If those places are connected, and if we ensure that there's seamless connectivity from the time I walk into that clinic to the time I go home and get hopefully care reinforced from a device as we're communicating now, from a connected series of devices that can monitor, my heart and oxygen levels and send those signals quickly to you. Then what's the possibility? What are the gains? Realized, and so what you quickly realize is it is very interconnected. It is interdisciplinary, and it is very necessary that we continue to work to, as we say down south, I'm down in South Carolina, that we sing from the same hymnal. It is very important that we are conscious about where we are, what page we are in that hymnal, in order for us to at some point in that book of songs, it's somewhere that we catch up and harmonize. And so if we don't recognize and acknowledge that not only is connectivity important, but I will shift things to the analog world, that that healthcare on the ground, face to face, that interaction. That if we don't have the biases checked, if we don't have the barriers, to access checked, just me finding a clinician, getting it to a clinician, and having a clinician listen to me and treat me with respect. If all of those other things are not in place, then you can connect me. You can give me, I don't care how many G's that are a part of my existence. If I am getting bad analog inputs, if I am being treated badly, if I don't feel comfortable, if you as a clinician do not respect me, and aren't really interested in healing me, then a digital health solution is not going to do a bit of good. In fact, it is going to further harm, because what these systems are doing, they're not solving the problem. They are amplifying what exists. So we
Mm.
need to be real careful about not getting in this single silo or single line of effort to say, oh my gosh, if I have this widget, or if I have this platform, or if I have this pipe, that is going to solve all our problems. If you got a person at the other end of this device that has not my best interest in mind, then it's going to be it's going to be more efficient for my outcomes to be even more negative. These platforms, I'm from the South, and I use the word sparingly, agnostic, but these solutions are agnostic. They don't have a heart or soul. And so what they're doing is looking at what you input. Those algorithms are input by a human. They're not they're not self-effectuating. Someone is at the other end of that development spectrum. And if they do not have whole of community in mind, again, with that empathy and with that need to solve what the problems are, then whatever is wrong will be more exaggerated, and what ever hopefully is more right will be more ubiquitous. But we have to work on what's wrong, because there are a lot of things wrong in our system.
Mm. Tech amplifies what's there already. I like, yeah, it really, really does. And health is more than healthcare. You're saying, you're talking about human-centered care. We're thinking about, really, truly humanity, and it's the air we breathe. It's the spaces and places that we go. It's the food we eat.
Right.
Health is everywhere and it's everything. And there's tech providers creating really creative, interesting, fantastic solutions. But you're right, they amplify what we have already here. Um, I want to get into the human-centered piece in a moment, but I just do want to dive a little bit more. You've spoken about it. You've spoken about if there's a lack of empathy and care, or maybe it's in it. Then there's bias in care. Yeah, there's bias in care. We know more women are invisible in healthcare. There's a higher the outcome issues with how women's health is treated. There's a spotlight happening on that right now, and actually, it's quite extraordinary. Ipsos have just launched an entire series on called hysterical health, and how women's issues are ignored and become invisible because of biases that exist in society. It's just one example. Could you kind of, even in a rapid way or through one or two things, give a bit more of a sense of health inequity that you're aware of, that you want to bring to the attention of the audience listening?
There was the most troubling article I read a few months ago in the daily newspaper in Columbia, South Carolina. And the headline, if I remember correctly, was called "The Cut." Now, we might think about the cut in terms of making something or not making something, but this cut was a number of amputations in the zip code where I spent the majority of my life in Columbia. My zip code had the highest proportion of amputations, and this is in the city of Columbia, South Carolina. This is blocks less than 2 miles away in that zip from the major hospital system in Columbia, South Carolina. Yet you saw people losing limbs at just a sad, disproportionate, incredibly painful rate. Why is that? You cannot sit here and tell me that African Americans are just predisposed. That's You're dismissing the obvious. You're dismissing the fact that I grew up in a food desert. You're dismissing the fact that even if where there were options, that if an apple costs more than a candy bar, what do you think somebody's going to choose? You're dismissing the fact that I would have to take off from work and stay in a clinic all day in order to get seen, and the type of interaction I have might not be all that engaging or all that desirable. So, at every step of the way, from the time that you were born in this brown field that might have been a dump, where the dump might be in your backyard that the city or the county or whatever is using, causing further environmental harms, and me having being predisposed to asthma. You're talking about intergenerational inequities or a lack of access to clean water and food options. And then you sit here and wonder why at 30 or 40 or 50, I'm an amputee. There's no mystery there. There's no question why this outcome is. You just have the unwillingness, I'm sorry to say, of too many people in our society, unwillingness to do anything about it, unwillingness to open their eyes. I
Mm,
shared that article with family members and friends, and we couldn't talk for a few days.
mm,
But what's the solution? That article ran. They will undoubtedly win a prize on it. It is one of the most informative I've ever seen. I hesitate to say best because
mm,
it's so painful. But what are we going to do about it? Now, if other things were in place, then these layers of digital solutions would be the solution. But the other things are not in place.
mm,
I cannot take off from work to maybe be seen. I cannot do that and keep the rent paid and to be able to afford hopefully that apple over that cinnamon bun. So we really have to sit back and again work with technologists and innovators and regulators like I used to be, and to make sure that we're sending the right signals, make sure that we are funding and promoting these solutions that have the promise of addressing these disparities, but one on one, ensuring that I have a clean environment, that I have clean and healthy food options, that I can afford connectivity and clean and healthy foods, that I can afford to go to the doctor if I don't have time to go to the doctor, that I have a device that's not going to give out after 200 minutes or 200 texts, that I can afford to keep in touch, with a professional. We have to do all of that and consider all of that from design to market. And the market is vast. and the engagement is both analog and digital. There is no disconnect when it comes to delivery, when it comes to better health care, better outcomes, and more opportunities for those on the wrong side of the digital divide.
Yeah. Yeah. Take a deep breath. It's just, yeah, it's a lot.
It's sobering.
Yeah, so is, really is. I tell you what, 30 minutes is not enough for this conversation and time with you. I'm just looking and I'm like, okay, right. So there's so much to still say. And I'm sure people can follow up with you to kind of get deeper into this. And I urge you all to, because this is really, really important. And I think Mignon's given some fantastic inroads to really think about intention and think about your role, because we all have a role. So let's kind of focus on that now. What is it people can do at an individual level, citizens for their own health? What can they do? What can I do? What can we all do? And then what is it that really we're saying to the industry about what they need to be doing? You have spoken about it, but let's really kind of hammer home the message. What would you like to say?
So I will start from the individual to the more, I guess, I don't want to say complex, but the more involved. Each of us can take someone to the doctor, take notes, reinforce that with the individual to better ensure that they adhere to the protocols, that they have the support needed. One of us can adopt one other person, and if each of us does that, think about the number of people that might be on a better track. Regardless of who we are, what we are, or how much we know, each of us can do that. So that's, to me, the most basic, where you can literally help your neighbor survive and be more healthy. As an innovator or technologist, from the beginning, as you are coming up with your design, ensure that's inclusive. When it comes with your testing and your protocols and refining, make sure those teams are inclusive, that you talk to the community, that not only you have in mind, but the others who could possibly later in that cycle be a part or benefit. Make sure you are doing no harm when you come up with the design, with the models. As a regulator, as a government agency, regardless of where you are, ensure that you're sending the right price signals, the right support signals, the right regulatory signals to ensure that the right systems, the companies that are doing the most innovation, that are closing these gaps, that have the solutions, that they have the support. That respectfully, either big tech or big telecom is not gobbling up or taking all the oxygen, out of the room and leaving some of the best innovators behind to starve. We can do that, in terms of government, and those of us in the private sector. Uh, who might have a dollar or two to crowd fund or invest, let our money follow where our hearts and where the opportunities and where the markets are. We cannot afford to be passive. We don't have to be passive or sit along, the sidelines. We make decisions based on market and economic purchases. We vote with our feet and our wallets. Let's do that here when it comes to innovation and design. If you know somebody has a grand idea, pool together and be an extended digital family and support that model, support that innovation, and help that innovator get from market design, to market, and help them with all of the bells and whistles. If you're a lawyer, help them put together the project. If you deal with regulation, help them navigate, those paths. Each of us has a role to play, and there is no role too big or too small for us to engage and be a part of. If we want different outcomes, it's going to take a community of 300 plus million US citizens to be active, not passive, about having better outcomes in a more digitally equitable and empathetic future.
Goodness. I'm leaving Reach Live today richer in insight, richer in just, yeah, a behavior pattern that I can do. I mean, it's so powerful. Just go take someone to help with their health, help with the playback, help them understand. So much is lost in the consultation, so much is lost in mismanagement of health. Extraordinary stuff, Mignon. Thank you so much. Genuinely, thank you so much
My
for
pleasure.
your insight and your words. I hope this goes far and wide because there's so much learning here. So thank you. Thank you so much to everyone joining us for Reach Live. I have no doubt you've enjoyed it because I certainly have. So we'll be back next month with a new guest. Please sign up and subscribe. Subscribe to the YouTube channel. You can catch it on LinkedIn Live. Follow the handles for Reach, where we bring more excellent content like today and some extraordinary individuals. Mignon, thank you so much. And I wish everybody a wonderful Friday. Thank you.